Hi, my name's Lorez Meinhold. I'm the Executive Director of Caring for Denver Foundation. Appreciate all of your patience as we had some technical difficulties. So we're streaming live on Facebook and we will record this and post this to our website. So really so grateful that you all can join us today to talk a little bit more about care provision, our fourth funding area for Caring for Denver. We will be taking your questions via chat, so I will do my best to answer those questions, and we have somebody that's going to be putting some pieces, links in there, so you'll be able to get some of the information or link to those direct resources. I'm just going to briefly walk through the call for proposal itself. You all should be able to access this document if you go to our grants page and applying for a grant. You can see the link to the call for proposals itself, as well as the application and a lot of the other resources. So a reminder, Caring for Denver was created, founded and funded with voter support to address mental health and substance misuse challenges in the city and county of Denver. And so it's through the great work of organizations like yours that we can do that. And we are focusing on care provision, this area. And care provision is really looking at that formal care setting. So how can we put funding towards supporting innovative mental health, trauma, substance misuse services, which make care more accessible and it fits Denver's needs. It ensures providers have what they need to provide that high quality, culturally informed care, as well as really that coordination to ensure that the consumer, the community member comes first in this care. And so I'm just going to walk through at a higher level the overview of care provision. And again, you can look at sort of more specifics so you don't hear me reading through everything. But what we heard from community when we asked them in this care provision, related to this more formal setting, how do we have more trusted, accessible care that fits our needs, whether that's around mental health or substance misuse? So how do we make sure that when somebody says, I need help, I need care, that they can get access to that help or care when they ask for it? Access to and the use of trained peers, so people with lived experience, and care that's accessible in the ways that work for community. And then really looking at some of those crisis response so that we really have that continuum of care. We have funded earlier in that community centered. So we built and are building more supports where people live, work, play, pray, trust. And now we also know that we need, when folks have higher level care, we need sort of more accessibility in that residential treatment, in that inpatient and outpatient supports, in sober and recovery living, in crisis supports to manage immediate and ongoing needs, and really help in those transitions. Care providers have, again, what they need to provide high quality care, culturally informed care, so that, again, they can better serve their communities. And then available supports work better so the consumer comes first in mental health and substance misuse care. So really, how do we better leverage, again, peers, or expanding the relationships and partnerships to really allow that continuum? So when people have higher needs in community, they can sort of be guided to that higher level care. And the impacts we seek to have is really increased access to and the use of supports that improve mental health and substance misuse care. Improved quality and fit of available supports, and strengthened relationships that help keep Denver residents engaged. Again, this is that formal care setting. How do we also sort of encourage those partnerships so that community needs are reflected in the care and services that are developed as they're expanded? So some of the considerations, really we're looking for that demonstrated partnership, even with those formal care settings, those demonstrated partnership with communities they're seeking to serve. Experience working with communities, can develop and maintain productive and collaborative partnerships, and they value culture and healing and identity. Again, we serve Denver And in this, mental health and substance misuse has to be a core component of what you're doing. There's a whole set of things that we will not fund. We are not in this moment funding general support or general operating. So really looking for those programmatic expenses related to mental health substance misuse. And it must serve residents of the city and county of Denver. If you have received funding within this year, it is less likely we're able to consider. We've had 2 to 3 times the amount of requests than we have dollars available. So we're really trying to promote the broadest spread. And as I say that, I recognize we are in that final process of making decisions around youth. So not everybody might have heard about their youth grants. That will be in the middle of March, around the same time this is due. So we recognize there might be some, if you don't receive funding, you can still apply. If you've received funding, we just might not be able to consider in this youth area, we might not be able to consider it in care provision. And so I know that timing is not ideal, but the timelines and deadlines, again, we opened up this area on February 16th. We're doing a live event now to answer all your questions. If you have not already applied for a grant or have not registered in our portal, then you need to register by March 15th. But if you have already applied once before or just registered to try to see what it's like, you do not have to register again. The proposals will be due March 18th, and then we'll notify you in May of that award. So with that, I think I'm going to go to all of your questions, and I will do my best to answer them. What is program-related investment? Because that is one of the things we say we don't invest in right now. And right now, program-related investment would be things like capital expenses. It would be things like a low interest, no interest loan. It can be a variety of things. It's some tools that other foundations have used to better leverage their dollars. It might be social impact bonds, things like that. Those are the things we are just not in a space to do right now, capital or loans or anything like that. So right now, those are excluded. How are we defining formal care? So as if you all have joined us before, I try not to define too much because again, we're trying to be responsive to what are the needs out there. But when I say formal care, it is more that clinical side. It is more that it is more, again, and I hate to even put definitions, so I know this is not as helpful. And I'm going to recognize that probably in a year's time when we come back to care provision, I can better define some of these things as we see some of the proposals and see what fits and doesn't fit. And so as we're going through it the first time, it is sometimes a little harder to say exactly what it is and isn't. But I will say it's more of that higher level clinical need. Because we've already invested in community center and we will continue to invest in community center. Community centered was really about those supports in community that really help people come into mental health and substance misuse and connect where people are to get that care. What we realize in community is then there's some higher level needs that can't be met in community and they need to be passed off to a higher level of care. And I think that's what we are really talking about in this sort of formal care setting, that higher level of care to meet people sort of within those needs. So more of those clinical settings. And again, happy to have conversations. So what I'll say is I will, if there are questions about whether you fit or not, I am happy to, you can send an email. There's a link on our website. You can send us an email. We can set up some time. And while we won't be able to talk about your proposal specifically, what I can try to do is really help understand what area of our funding you might fit best in. Does this grant cover staff training to increase resilience, well-being, culturally sensitive engagement? Yes. So staff training to ensure that people have the right level of care as it relates to trauma-informed care or whatever the care that is needed, or to better work with community and understand community and cultural and community needs. That training can be part of this grant proposal. Well-being is important. We know, especially during this time of COVID, how do we support staff in this time so that they can stay in this work, is something that we will consider. But again, this is really about also reflecting and respecting the community you're serving, and how do you make sure that whatever training and care you're doing is really reflective of what community and the community you're serving needs. Does it have to have a substance misuse component? No, this could be mental health or substance misuse or both. So it needs to either be mental health, substance misuse, or substance misuse and mental health. We know folks sometimes deal with both because they're not always so separate. This is the question we always get, is what is the average grant size? And because this is going to be our fourth, we've been doing this for a year, each funding area has had a different average grant size. So what I'll say is for alternatives to jail, it was and again, sometimes these grants are 1, 2, or 3 years. So even when I say an average grant size, it could be that is inclusive of what somebody asked for over 3 years. But in the alternative to jail, it was around 500,000. In community centered, I'd probably say it was around 200,000. And then in youth, I'll probably say sorry, I got a text about sort of some confusion, so I'll address that in a second. But in our youth funding area, it was probably around that 200,000 again. So again, that can be 1, 2, 3 years. So what I'd always say is ask us for what you need. You can ask for 1, 2, or 3 years. On average, we've been getting 3 times the amount of requests than we can usually do. So just make sure the budget makes sense and is sound, but we won't not consider something. If the size is too big, we'll come and have a conversation with you about that. But recognizing there's 10 million in this funding area, and for our last funding area, we had over 100 applicants. So probably, as you think about large grants, really knowing that there's a lot of needs out there, and we're trying to have the best responses possible. And so I think there was a little confusion when I was trying to address. We know some of you may have applied for the youth grant, and you have not heard yet, and you will hear in the middle of March. March 15th or later is when we plan to notify grantees of award in the youth area. The closing date for this grant application is March 18th. So even though we say we only will fund an organization typically once in a year, we're trying to make sure that we have that spread. It's not a hard, fast rule, but we're really trying to make sure we can fund as many organizations and agencies as possible. We know you're not going to necessarily know the answer on the youth before you have to actually turn in a proposal on care provision. So I am just acknowledging that. Acknowledging that you might submit a proposal, and if you get funded in youth, we might or might not be able to consider that in care provision. So hopefully that clarifies that piece. RFP uses care providers and caregivers interchangeably. Please clarify. So we know sometimes there are family members that are caregivers, or there might be other people that are trained peers that fall in care providers, but sometimes caregivers. We were trying to be general in that. And what I will say is, in your proposal, define who you are looking to serve and what support you are trying to give, so that sometimes community members might be part of your care team. They might not have a licensure or certification, but do they need training? Or do they need respite? And so I think we were just trying to we've heard both when we talk to community, that we need to support both care providers and caregivers. So we were reflecting that in this call for proposal. What do you mean by right now care? And again, I'd probably go, right now, care means that I show up and I say, I need help and I would like to get mental health and or substance misuse treatment. And sometimes I'm told I need to wait 6 weeks, 6 months before I can get that care. And many times if we do that, that means people's recovery is delayed, or it will be a while before they come back and come to that space. So when somebody says, I'm ready and I need access to care, how do we make sure that we can get people connected to care right then, right now, when they're asking or needing for it? And so again, I know that's not a we can do that tomorrow, but this is about working us towards how do we get towards more of that right now care. Can we apply to all 4 areas, or is it best to focus on one area per year? It is best to focus on one area per year. Again, we have received generally between, in alternatives to jail, I think we got close to 70 or 80 requests. In community-centered, over 100, youth over 100, or just right around 100. So we are getting many more requests than we can fund. And so it really is thinking about what is the area that you feel like you fit best into. But again, we know that you might not get funded in that. So does that mean you can apply in other areas? Yes. But once you get funded in a year, we're probably asking you to not necessarily apply as a lead applicant in any of the other areas. Are collaborative applications considered? Yes, built with more than one grantee. We do love collaboration. Collaboration is important, and when you build a collaborative grant, that shows that you are working well with other organizations and other players and really trying to look at this system of care. But you are not required to do it with more than one grantee. So again, partnerships take a lot of work, and partnerships need to be thoughtful. Because you're really aligning values and cultures and organization. And so it's important for you not to do this just because there's a grant opportunity, but to do this because it's meaningful for you and it's meaningful for the community you work with. So we're really looking for authenticity in these partnerships. May for-profit organizations submit a programmatic proposal? No, at this time we fund nonprofits and agencies. That doesn't mean in the future we might not look at that. That sometimes falls in that program related investments and expenses when you invest in sort of or outside of that nonprofit, city agency, government kind of category. But it doesn't mean as a for-profit you can't be a partner with a nonprofit or another organization. But we can't fund for-profits directly at this time. Does care count as mental health? Does care meetings? Care. We will get some clarification on that question. I'll come back to this. Would childcare for parents seeking substance misuse? I'm assuming is, can you cover those costs or qualify? Yeah, I mean, again, if that's what helps parents stay in care, we would like to maybe not see that be the sole purpose of the grant, but we recognize there are costs or supports that families or parents need in order to be in that care. And so if childcare or food are some of those expenses to support people in care and recovery and is one of their needs, that is an allowable expense. Does care management to support access to resources and services count as mental health? Does care management? I am going to say I'm not quite sure what you mean by care management. If you are talking about case management, and this is where I'm going to maybe use a term that I use, and so I'm going to recognize sometimes we use terms and they don't always mean the same thing to everybody. But does case management, so peer navigators is a perfect example of somebody that helps you navigate care to ensure that you get connected to the right care, stay in that care. So if that case management, care management is about connecting to mental health and substance misuse care, then that is something that we could fund. If it's case management to all the other needs, which again, let me say, I do recognize and value all the social determinants that comprise and help people stay in recovery. But given our ordinance language, we are really focused on that mental health substance misuse side. So what I'll say is if that case management, if that care management, if that peer navigation is really about connecting to mental health and substance misuse supports, then yes, we can support that. Are we looking solely to fund a program or contribute to a program funded by other funders? No, not necessarily. So, over time, we'll ask that same question other funders ask about sustainability. So, we will fund brand new programs. We will fund brand new things. We will sometimes be the first funder of a program because we know that sometimes that idea needs to get launched. We'll want to understand what's your experience in starting new programs, or why do you think this will work? What are you basing this on? What does that look like? Over time, we hope other funders will pick it up. An example of this, one of the programs we funded that had never been funded before in our Alternatives to Jail space was the STAR program, which paired a mental health provider and a paramedic EMT to be dispatched by 911. We did not have a program like that in Denver. There was one that existed in another place. We modified it. We funded the pilot, which then is now being funded by the city, and likely they'll come back to us for other funding requests. But so again, we will look at new and innovative ways to look at how we do this, and we'll be the first funder in. Over time, we don't necessarily want to be the sole funder because that leaves that program pretty vulnerable to what we can fund. And just as a reminder, in our ordinance, every 3 years we go back to community and say, what's important to you? Where should we focus the Caring for Denver fund? And because that might mean some of our funding areas might need to change. So that's why, like other funders, we'll ask about, even if we are the initial funder and help get that launched, we'll want to know, how do you anticipate continuing to have it funded? And we will help you in that sustainability. We don't say you own it solely, but we'll want really sort of thinking about, if we are the sole funder, how does it how does it continue beyond our funding? Or how are you going to support it long term? Because, again, it's as important as we are trying to build trust with community. It's really important to not provide something and then pull it away. So we want to invest in you and that community partnership. Does it have to have a substance misuse component? No. Again, these proposals could be mental health, they could be substance misuse, or they can be mental health and substance misuse. We recognize the connection, but we also recognize not everybody addresses both of those issues. I'll say generally we've had probably a third of our proposals will just either address mental health or substance misuse, but many of our proposals address both of them, but it's not a requirement to address both. So for the there's a question around the impact areas or the focus areas. So there's a 1, 2, and 3 in the call for proposal. You do not need to address all 3 of the overview areas, nor do you need to address all of the outcomes. But you need to address at least one of the funding overview, at least one of the outcomes, and really look towards the award considerations. Please do not ignore the award considerations, especially with how competitive these grant proposals have been. We have relied on those award considerations as a way to lift up grants. We're still waiting to hear on an existing application. Maybe apply with a new request in this round. Yes, and I tried to address this before, and so again, I recognize that different people are coming in at different times. So the youth funding area, we'll make those announcements in the middle of March. At the same time, these ones you will make that application. So if you are funded in youth, it's less likely we'll be able to consider it in care provision, but because you won't have that answer for youth, please go ahead and put in that application so that if you didn't get the youth, then you are competing for the care provision. But again, happy to talk to anybody if they have questions about that. It's just if you get funded in youth, we might not. That will be a consideration as we're considering it relative to the other grant applications we received. So there were a couple of organizations that applied under community-centered and really were a better fit for care provision. So there's questions about, can we just tweak that application and resubmit? Yes. But just make sure you take a look at the call for proposals. So what's different is what we were focusing on community-centered, both in terms of slightly the overview and then the impacts are different. So the tweaking is please respond to what's in this current call for proposal. But yes, if you were told in community-centered you were a better fit in care provision, come back and submit in this funding area. And I'm waiting for one more question to be written, so I will give you a moment to catch up. And I'll check my text to make sure I'm not missing anything. Is it appropriate to use funds to cover costs to connect with music community? It can be. So I think, again, you'll just need to make the tie between how you're using. So if you've looked in our other funding areas, we've talked about art and art of all kinds as a way to connect to care. Sometimes it's a way art is used as an expression. And in this art, I'm using music, I'm using art of all kinds, poetry, yoga, whatever that might be. If that's a way some of the care, this sort of care provision is looking to bring in some innovative ways to really respond to community needs, then yes. So I will say though, is it to put in money to partner with them, to have them be part of that care provision? Yes. Is it a planning grant where you're looking to try to figure out over the next 6 months who you might partner with? That might not be as competitive a grant. We're hoping that you have some of these partnerships already built or developed, but that's not necessarily a requirement. And again, it'll be a consideration as we look through all the different grants that we get. But if again, in that care provision, you've heard from community, we need alternative ways to engage and connect, and music is one of those. Make sure you identify that came from community and why you're using it, or why you're using it, or why it's important. So again, why it's going to work. Clarify youth is closed and won't reopen later in a year. So yes, I will clarify that the youth call for proposal is the one we closed right before the holidays, the Christmas holidays. Youth will be open in another year. So the 4 funding areas that we have are alternatives to jail, community-centered, youth, and care provision. So the next funding area after this care provision will be alternatives to jail, and then we'll go back through community-centered, youth, and care provision. And so we will generally have those 4 in a year, which is, again, if you were to start in January, it would then flow care provision, it would then go alternatives to jail, then it would go community-centered, and it would go youth. And so those are the 4 funding areas that we will have happen at least for another probably 2 years. We'll have to go back out again to community to identify that those are still the right same funding areas that are important to community. But again, that will be the general order. And you can see that we have a timeline, sort of a general timeline on our website, and it gives you a sense of that cadence. Do you fund cultural resilience programs for emotional and behavioral health for disproportionate community? So what I'll just say is cultural I think again it's sometimes hard to understand what's in sort of some of the programs. So when you say cultural resilience programs for emotional and behavioral health, so we know there's trauma that's experienced by communities. And so if you are addressing trauma and addressing mental health and substance misuse for communities, whether that be Black, Indigenous, people of color, communities with people with disabilities, there's lots of different communities that have experienced trauma. And emotional and behavioral health is, if that's how it's being addressed, it's something we can consider. So again, I'll just say it's sometimes the specifics give us a little more detail into what that is. And so again, if whoever wrote that one wants to talk a little more, please reach out, and I'm happy to try to add some clarity or try to understand the specificity of, is this addressing trauma in communities? Is this about building that mental health substance misuse support? And we recognize in different communities, because of the stigma that's attached with mental health or substance misuse, you have to approach it different ways. And that's why we've talked about innovation and looking at this differently and making sure, are you using sort of reflecting culture in your practice? Those are going to be things that are important, but happy to talk about it more because I don't want to lead you down the wrong path and have you said yes on this. So let's make sure we talk and make sure that I understand what that is. When will Youth Awards be announced? That will be announced in the middle of March. So we will start going out that week of March 15th, March 22nd to notify all potential awardees that both awardees and declinations. So it'll go out those 2 weeks. Who should we email for a meeting to discuss if we're applying for the right area? We put Leia's email on there. I get pulled into a lot of those conversations. So for right now, let's have that be Leia, which would be caring4denver.org. So we'll put that in the chat so that you have that. So Leia really can help with a lot of the questions around sort of the application itself. When it's questions around, are we applying for the right area? What do you mean? Then I'll generally get pulled in with that. I'm going to ask if you are grantees or if you are awaiting a decision and working with the program officer, you not reach out to the program officer. Part of the reason being is that we are following a city of Denver because we're a component unit of the city of Denver. Once a call for proposal is open, somebody that would be reviewing the proposal can't talk about the proposal with you. I am not reviewing each individual proposal. It's the program officers that do that, our staff that does that. So that's why I can have some of those conversations with you about if you're applying for the right area. Can we request a grant to provide disability adequate training for mental health and substance misuse providers? Yes. I would say it would be great if you had those partners lined up, like who were those mental health substance misuse providers, but that culturally appropriate care is super important. And so having people understand, especially when we're talking about folks with intellectual and developmental disabilities or physical disabilities, that it's really important that providers understand and respect community and cultures. Do you consider training around transgenerational trauma as community-centered? Do you fund neuroscience training for staff? I think we'd have to understand this a little more. So the transgenerational trauma is, again, it depends. So maybe what I'll say is it depends on who the training is for. So like in the last question, it was, training for mental health substance misuse providers. I would probably say, is that training around transgenerational trauma for formal care providers, those care providers in those clinical settings, or is it for community and community members? And so that would be the difference, whether it's community-centered or whether it's care provider. Neuroscience training for staff, it's a possibility. Again, I think we'd want to understand how that training was identified as a need, what difference will it make in sort of the care that's being provided. So is that something that was requested by community? Is it going to sort of really make that care more accessible, and sort of really understanding how that relates to the call for proposal itself. Would we fund healing modalities or communal care rooted in indigenous practices? And the answer is yes. We would definitely look at that as a consideration, because we know that cultural healing is the modalities of healing, while sometimes focused on that Western space, don't necessarily work for all communities. And so trainings or treatment that are focused on somebody's identity, and working in that sort of cultural healing is important. We heard that that was really important from community, so that is something that we would consider in terms of training. So I'm gonna pause a second, see if we have any more questions, and again, you'll have sort of a way to reach out to us. And we can answer some additional questions. And so again, some of this is, as I said, we're going to learn more as we do this, and there's lots of opportunities. We know that you all are doing amazing work, and unfortunately, we can't fund every proposal we receive. And so we're doing our best to help you understand sort of this. But I will just send, please make sure you look at the call for proposal. Please make sure you look at probably our funding document, because when you look at our funding document, it sort of also gives some of the words that community used to say why this was important. And so we use that. You mentioned average size for youth is 200,000. Does that mean decisions are finalized? No, it does not. It was why I was doing an estimate. And an estimate is just that. We looked across all 113 grants and looked at the average size, regardless of 1, 2, 3 years, and just said, this is the general size. We have not made decisions. As many of you know, we're in the midst of some of that review, and the decisions will be made in March. So decisions are not finalized yet, but we are working on that. Yep, the youth decisions. For youth decisions, can we be notified earlier than March 15th? No. It is, so again, these are recommendations made to our board of directors. And so as in this call proposal, we identify when decisions are made. Same with youth. Decisions are made. If you look at our youth call for proposal, the decisions were made after March 15th, and that is not a soft deadline. You know, and again, I recognize this is a pretty hard cadence. Part of the reason we, from receipt of grant to award of grant, we do that in 4 months. Most foundations have been working on an average of 6 months or longer. We know these are community dollars, and we're trying to get them out to community as quickly as possible. But 4 months is a pretty quick turnaround, and so that's why we can't really do this earlier than sort of the deadlines we approached. Clarify starting Denver versus non-Denver residents. So residents of city and county of Denver. And so we have actually, if you go to our eligibility page and go to our call for proposal, we talk about, or a frequently asked questions, sorry. There is a description of what does it mean to be a Denver resident. It's also defined in the eligibility of the call for proposal for this one. So it's an individual residing full-time in the city. They might not always have an address, so it's somebody maybe experiencing homelessness in the city and intends to stay in the city. It's somebody under the age of 21 and in the custody of Denver Human Services, anybody under the age of 18 in a legal residence or custody of a city resident, somebody that might be in a city jail, somebody that is in our Denver public schools. Citizenship is not, as long as they're residing in Denver, there's not a citizenship requirement we have. It's really a resident. Where are they residing? And it is the city and county of Denver, which is different than the Denver metro area. That can be more expansive, but the county of Denver is the city and county of Denver. So we can only fund, because these are Denver tax dollars, we can only fund Denver. So does that mean you as an organization have to be in the city and county of Denver? No, but we can only fund the amount of work that goes, or where you're working with Denver city residents. I will give you an example. So in Alternatives to Jail, we funded Second Chance Center. Their physical location is in Aurora, but they serve a certain portion of Denver residents, because that care feels right. It's comfortable. It's a place they want to go to get to that pathway of recovery. But then that agency does track the number of Denver residents they serve, and that is the part that we're funding. So there is if you are outside of city and county of Denver, there is an added accountability for you to be able to track the number of Denver residents you're serving. So that is most of our questions. They're great questions as always. And I appreciate the time you spent with us. I appreciate the energy and time you put into looking into these grant opportunities. I appreciate and value all the work you do to serve the residents of the city and county of Denver. Mental health and substance misuse is a great need in our city. That's why we're able to pass with such a strong vote, and we're grateful to all of you and all the work you do. And we look forward to continued conversations. So with that, because we have no more questions, we're going to end this live video. But really appreciate all of you. Again, look forward to continued conversations and continued partnership. And have a great day.